Hey, welcome to The Explainer. Today we are talking about something called thrombosis. It's, the science behind blood clots. And these things are one of the biggest and quietest threats to our health.
So let me ask you something. What could possibly connect a long flight, a major surgery, and a sudden stroke? They seem totally unrelated, right? Well, the answer is this single hidden process, and I think you'll be surprised by what it is. So that connection, it's thrombosis. And all that means is a blood clot forming where it shouldn't, inside a blood vessel. And get this, it's the single hidden cause behind the world's top 3 cardiovascular killers. We're talking heart attacks, strokes, and something called venous thromboembolism, or VTE for short. That's just a clot in your veins. All right, so let's get into how this actually happens. A blood clot on its own isn't the bad guy, right? I mean, it's how we stop bleeding. It's a totally vital healing process. The problem is when that process goes, well, rogue. It's almost like a conspiracy starts inside your own body, and there are 3 main players involved. And this conspiracy actually has a name. It's called Virchow's triad. It's this super foundational idea in medicine that was figured out way back in 1856. Think of it as the classic blueprint for this crime, the how and why a dangerous clot shows up. Okay, so let's meet our 3 co-conspirators. First up, damage to the vessel wall. This can happen from surgery or maybe plaque buildup that roughens up that super smooth lining inside your blood vessels. It basically gives a clot a place to grab on and start. Number 2 is abnormal blood flow. When your blood slows way down or gets all sludgy, that's a state we call stasis. The clotting stuff can start to pool. This is exactly what we worry about on a long flight. And the third conspirator? Hypercoagulability. It's a mouthful, I know, but it just means your blood is stickier than normal, more likely to clot. And here's the kicker. You usually need at least 2 of these 3 things to happen for the risk of a clot to really go up.
Now, where this all happens, that matters a lot. See, you've got 2 different crime scenes. In your veins, where blood is just kind of cruising along slowly, clots are usually caused by that slow-moving, sluggish blood. That's where you get things like a deep vein thrombosis or a DVT. But in your arteries, it's a whole different story. That's a high-pressure system. There, the main trigger is usually a piece of plaque that suddenly breaks open, causing a clot to form right on top of it. And that's what leads to a heart attack or a stroke.
Okay, so this all leads to the big question, right? Are you at risk? Who are the potential victims here? Because honestly, understanding this stuff is the single most important step you can take to protect yourself. So a lot of the big risks come from things that happen to us in life. I mean, think about it. A major surgery or a hospital stay. You've got potential vessel injury, and you're not moving around. That's a classic setup. Or just being stuck in one position for too long. Yep, like that long flight again, or being on bed rest. But there's more. Things like cancer, smoking, being obese, and even hormonal shifts from things like pregnancy or some birth control pills can tip that balance in your body towards making clots. But it's not always about what we do or what happens to us. For a surprising number of people, the risk is literally in their DNA. It's something they were born with, written right into their genetic code. So how common are we talking? Get this. A staggering 1 in 20 people of European descent have the most common genetic risk factor, which is called factor V Leiden. What this mutation does is pretty simple. It makes one of your key clotting proteins really hard to turn off, so the clotting process can just keep on going, which massively jacks up the risk for a DVT. So, okay, let's say a doctor suspects there's a clot. How on earth do they find this hidden threat? Well, the whole process is kind of like a detective story. It's a very logical, step-by-step investigation to uncover the truth. The investigation always follows a clear path. First, it starts with just suspicion. Doctors use tools, like something called a Wells score, to basically calculate the odds of a clot. If the odds are low or medium, they move on to step 2, the clue finder. This is a simple blood test called a D-dimer. And if that clue points to a problem, then they bring out the big guns for confirmation. That means imaging, like an ultrasound to look for a clot in the leg or a CT scan to find one in the lungs.
And this is really important to understand, especially that D-dimer test. It's a vital clue, but it's not a confession. See, it measures tiny fragments that get left behind when a clot breaks down. If the test comes back negative, that's awesome news. It pretty much rules out a clot. But a positive result isn't the smoking gun. Other things, like a recent surgery or even an infection, can make it go up. So a positive D-dimer just tells the doctors, okay, time to look closer. It tells them they need that imaging to get the final answer. All right, so the clot's been found. The final chapter of our story begins. It's time to fight back. And thankfully, modern medicine has a whole arsenal of really powerful tools to stop this threat in its tracks.
The two main weapons here are called anticoagulants and thrombolytics, and you have to know the difference. Anticoagulants, what most people call blood thinners, they're the workhorses. No, they don't actually bust up the clot that's already there. Instead, they lock it down. They prevent it from growing and stop any new ones from forming, which gives your body the time it needs to dissolve it on its own. Now, thrombolytics, or clot busters, those are the special forces. These drugs are designed to actively dissolve the existing clot. They're only used in really severe life-threatening emergencies, like a huge clot in the lungs, because they have a much higher risk of causing serious bleeding.
And even within that first group, the anticoagulants, there's been a huge revolution. You have the old guard, which is a drug called warfarin. It works, but it's tricky. It messes with vitamin K, and you need constant blood tests to make sure the dose is just right. But then you have the new guard, these drugs called DOACs, and they have been a total game changer. They work by targeting just one single clotting factor. And for most people, that means no more routine blood tests. It's made treatment so much simpler.
But what about the absolute most dangerous cases? You know, when a clot is threatening a life or a limb, sometimes medicine isn't enough. In those moments, specialists can go in and perform what's called a thrombectomy. They literally thread a catheter through the blood vessel and use tiny tools to physically break up and pull the clot out.
So we've seen the crime, we've followed the investigation, and we've watched the fight. It all comes down to this incredibly delicate dance between clotting too much and bleeding too easily. So in all of this, what is our single most powerful tool?
You know, it's just one word. Awareness. That's it. Knowing your personal risks, recognizing the signs, like, say, unexplained swelling in one leg, or suddenly feeling short of breath, and starting the conversation with your doctor. That, more than anything else, is the most powerful thing we have to prevent a silent threat from turning into a full-blown emergency. Thanks so much for joining me for this explainer.